Hello, guys and girls. Welcome to UK Dreamers. This is Aman, and in this today's video, we'll be talking all about nuclear medicine, the higher specialty trainee. How do you get in? What is the eligibility criteria? And to give you more about this information about this, we've got none other than Dr. Rafiq, who himself has secured a training position in nuclear medicine. So, Dr. Rafiq, welcome to the channel. Thank you so much.
Hello, everybody. Hi, Aman. It's a pleasure to be here on your channel, UK
Thank you
Dreamers.
so much. Because what you're gonna talk about today is very, very mysterious. I don't think much people know about it, and there's barely any information online. So I'm hoping this would be a great session for guys and girls who want to go into nuclear medicine, higher specialty training. I think even for the people who are applying for radiology training, more or less the basics remains the same for them to apply this, isn't it? So
That's
we
right.
will
That
talk more about this, and enjoy the video, go through it till the end, and it'll be very informative and insightful to you guys. So over to you, Dr. Rafiq.
yeah. So to begin with, just a brief introduction about myself. I was working as a trust grade doctor as a non-trainee. I came to UK 2 years ago. Worked in rotated in different specialties, medical specialties. So, as most of us, there was a confusion regarding which one should I pursue. Although my initial one was endocrine, then I changed to gastro, and so once I started working there, I felt it a bit overwhelming. The ward works and all this clinical works was a bit overwhelming for me. And one of my senior who has done his again my background, I have done my post graduation in internal medicine, so done my MD in India, and I managed to do the Royal College examinations where I was doing the MD, except for the PACES that I have done once I was here in the UK. So I know a senior who, although he has done all this internal medicine training, he has shifted to radiology once he started in UK. So taking advice from him and also doing some online research and everything, I like as you said, it's a mysterious. Nobody know about much available content is available regarding nuclear medicine. But I dig into it, and at the same time, I was interested in radiology as well. So the first thing I would suggest is to do a taster week. Do arrange a couple of taster weeks and see how you think about or what you think about radiology. And at the same time, when I was doing the taster week, I was exposed to nuclear medicine department, and I was a bit fascinated about it because it's no more black and white there. It's all colorful, and it's a lot of things going on in there. So I did more research about what is this, and then I came to understand it can be done as a part of group 2 specialty in as a part of group 2 higher specialty training in medicine. So, shall I quickly share what I mean? Many people may not be may not have gone through the whole list of things. So I'll quickly share a screen.
Absolutely, absolutely.
Um,
Please go ahead.
yeah. So this video I think mostly will be helpful for those people who are new to UK or just to just don't have an idea about what are these group 1 and group 2 specialties. And so I'll explain both the pathways to get into. So the pathway I have entered is through this one. It's a higher specialty training in internal medicine. So once you have completed the stage 1 curriculum, that's IMT 1 and 2 for group 2 specialties, and IMT 1 to 3 for group 1 specialties. So all of us will be familiar with the group 1 specialties here, because we more or less will be rotated. We'll be seeing these people around on the hospital. So we are much more in touch with the group 1 specialties. But the group 2 specialties, not many people except for hematology, immunology, or hematology and oncology, and some people who are interested in dermatology, except except for these few specialties, not many people are aware about the group 2 specialties. And one important one is nuclear medicine here as our topic of interest. Um, so we can see here nuclear medicine comes under the group 2 specialties. To start with the training, there are a couple of eligibility criteria for the nuclear medicine training as a medical specialty, as we said, we should have completed the IMT one curriculum. I mean, the
Stage
the,
one, you're saying.
the
Yeah.
yeah. The stage one curriculum should be completed as a mandatory eligibility criteria, and at the same time, it can also be done after MRCS or the surgical core training or the pediatrics core training. So MRCP or MRCS or MRC PEDS is a mandatory criteria. So once you're done with that, then you're eligible. The trickiest part is here that similar to the application for ST1 radiology, the whole selection process involves the MSRA exam,
Mm-hmm.
which can be a bottleneck for many people because of the professional dilemma part. The clinical scenario part, more or less, people will be okay with it, but the professional dilemma requires quite a preparation, focused preparation for that. Once you're done through that, then based on your MSRS scores and also for with the portfolio that you're maintaining, you'll be shortlisted for the interview.
So if I may
And
interrupt you, Dr. Rafiq. So basically, when you
yeah,
talk about the portfolio, so like we are being medics, if we are maintaining the
yeah,
portfolio, do you think our normal, the RCP portfolio is enough? What do we need to incorporate into it so it looks you okay? You're dedicated for nuclear medicine, like.
yeah. So I'll tell about that. So for an international medical graduate, we are supposed to maintain two portfolios in the sense those who have done their post graduation training in a different country and come here, they should they should maintain the JRCPTB physician portfolio first of all to get the alternate competency form signed along with the Royal College examinations. All right. And once you're done with your alternate competency form, which is different for the Group 1 and Group 2 specialty, this is the alternate competency form to enter the Group 2 higher physician specialty training. And this is a 2024 version. So it has all these requirements, like all the generic requirements and the specialty specific requirements. And the education supervisor should be signing you of all this evidence based on the e-portfolio that you're maintaining. And once it's done, you need to upload it during the application process. One, to show the commitment to the radiology, you need to maintain the radiology portfolio, which scores you, right? So this is important because it contributes to around 30% of your final score. So basically, it's like 20% of the MSRA score, 20% of the whole final marks will be from the MSRA, and 30% from the portfolio, and the remaining 50% is from the interview performance. So interview is the most important thing, but to reach the interview, it's a lot of things to be done, right? So looking at the scoring of the portfolio, this is the briefly what are the domains they're looking for. So we should have our own commitment to the evidence for the commitment to specialty, the leadership and management, teaching and training, formal teaching qualifications, audit and QIPs, academic achievements and prizes and awards. So this is a good resource, radiologycafe.com. So the applicants can have a look and see how we can maximize your score and significantly boost your portfolio. For example, one of the most important thing you should do is a multiple significant exposure to the work of clinical radiology department that carries 10 points. So it can be done with a couple of taster weeks, which can be in a meaningfully different settings. For example, if it's a DGH or a district hospital, then a tertiary hospital can be a second taster week session. Or if it's in the same hospital, then meaningfully different exposure during the taster weeks. Or if you're in a different, if you're working in a medical specialty or surgical specialty, if you attend the MDT meetings that involves the radiology, that could also be counted as a commitment to specialty. If you regularly attend it, contribute, present cases, and that's how you can easily score on the commitment of specialty. Then the leadership and management, if you any sort of leadership that you have. So although the higher ranking here, higher marking here are for radiology specific, which is quite difficult to obtain, but you can still manage to get 3 or 5 points based on your leadership exposure and experience. Then teaching and training, if you have made a major contribution to a national or international teaching program, if you have organized a teaching program, you can commit, you can you can put that both in leadership and management as well as teaching and training. And again, if you have any formal teaching qualification, there are many people who have done PG cert or PG diploma in teaching qualifications, or if at least the minimum you should do is like a 2 days that Oxford Medical teach the trainers, or any other similar training programs. Then another important thing to show the commitment to specialty is the audit and QIPs. So just get in touch with the radiology registrars, or you can yourself, if you have a medical specialty. In a department, they will be having a lot of radiology related studies or diagnostic procedures going on. So you can come to, or just get a audit or QIP done. So if you do two audits or QIP, then and try to present it in a governance meeting, show that you have made some change in practice, then you can score full points on audit and quality improvement projects. Then again, if you have a postgraduate research degree, it's quite so for people, for example, who have done MB in India, it's quite tricky because so it all depends on the panel who is assessing the score. For me, when I applied for the hematology application, my MD was considered as a postgraduate research degree. But here, the radiology panel, they haven't accepted it as a postgraduate research degree. But I was having a publication related to radiology as a first order, so I got 4 points in that. So that's other thing. Then again, the last one is the prizes and awards. If you have secured any prizes in an organization or a meeting, which can be local or regional level or national level, depending on that your prize, your score can go up as well. You should have both of this portfolio maintained at the same time, so it can be quite struggle from the side, but it's at the end of the day, it's quite worth doing it. And yeah, one other thing I would advise is that always have a plan B or C as well. So just don't focus on this one particular specialty, because one drawback of this specialty is the limited number of posts available across the country. So if you're very committed to the specialty, then depending on your how boosted your portfolio is and how committed you are, maybe you can easily secure a seat, but it's not always guaranteed, because as you know, the number of applicants are going up each year. The competition ratio is like unpredictable. The cutoff score for MSRA, it's again going up very high. So always have a different specialty in mind as well, and try and give for it. It's a good one.
So, Dr. Rafiq, when did you realize, okay, medicine is no longer your passion?
I wouldn't say medicine is no longer a passion. Um, so that's one thing that attracted me to nuclear medicine, was that it's a holistic approach it has. So you'll constantly be in touch with all the clinical specialties, because if you look at, I will show you the curriculum. I can show you the curriculum and see the procedures that's done under nuclear medicine. On top of a nuclear medicine as a part of as a group to medical specialty, as you know, this unselected take and the core training is part of it. So the reason they have put it as a part is because of the importance of general medicine, or uh, the importance of this core training as a as a part of nuclear medicine. This is basically because if you look at imaging, the clinical radiology, or that just deals with the anatomical abnormalities, but in nuclear medicine, they're overlapping and bringing another dimension in the form of physiological abnormalities as well. So that's the importance of medicine in nuclear medicine training.
So, I mean, if you were not uh, prepared well in advance. Like as you said, you have to do keep on doing two things at the same time. Like as we is applying for the medical specialties, people who might do it from the surgical or the pediatric specialties also have to do their bits and bobs for their core specialty and then focus
Right.
on it as a higher specialty, right? So okay, you say that when we do the taster sessions, so like for instance, how long do you think the taster session would be enough to fetch enough marks? Is it a day? Is it 3 days? What do you say?
So from the taster session, if you look at the radiology cafe, they'll give a descriptive, uh, uh, big explanatory description regarding each of these points, how they are marked, and also the oral website while you're applying also mentions about it. So it's considered for radiology training. 3 days is considered as one exposure. So multiple taster weeks in the sense at least two, which can be on the same hospital with two different set of exposure. For example, in the first set, you'll be exposed to interventional radiology, breast radiology, ultrasound, reporting, etc. And on the second, for example, nuclear medicine, in a day with the registrars, attending an on-call or things like that. If it's a meaningfully different. And on top of that, it's always better to attend the MDT meetings or present a case on the governance, clinical governance, like a presentation on the clinical governance. All this can contribute. So just I won't tell you need to stop with just two taster weeks and the claim for the full marks, because at the end of the day, it's the panel's decision whether. So it's always better to boost the portfolio by having multiple exposures, periodic exposures. So during your own call or when you're free during the evenings, if you go to and speak with the registrars or do something or try to gain something from them, that's also can be considered as a significant exposure.
That's great. So give us a little bit insight. So now you're going into nuclear medicine. How long is the training? What exams do you need to sort and stuff?
So nuclear medicine training, and again, quickly share the content. Yeah, so this is the GMC, just briefly showing how the nuclear medicine curriculum is. So if it's 8 years, if you are just getting graduated, then include, after your foundation year training, it's 8 years, including the core specialty, surgical or medical training, it's 8 years. So if you're applying after the IMT training, then it's 6 years, starting from ST3 to ST8. So the ST3, I quickly open the nuclear medicine curriculum. So ST3 to ST5, it's a core radiology training. That's like how they're dividing is in the ST3 to ST5. The first 3 years, there will be 80% of your work will be in clinical radiology and 20% in nuclear medicine. And the last 3 years, ST6 to ST8, you will be 20% clinical radiology. We need to continue maintaining the competency of the clinical radiologist, and 80% will be nuclear medicine dedicated training. So at the end of the training, you will be dual CCT both in clinical radiology and nuclear medicine. So where the exams, so I'll quickly go through the curriculum. So every applicant should have gone through the curriculum before the interviews, because there'll be a lot of couple of questions regarding the curriculum. So the generic SIPs and the specialty SIPs, as with every other specialties, we are supposed to show the our competencies of this generic and specialty specific SIPs. So this is the what I have just mentioned regarding the dual training. So once you're done with your core training, then there will be a selection process, as we have briefly mentioned, with the MSRA exams, the portfolios, and the interview. Then once you enter the specialty training, then it's 6 years. With we are supposed to do the FRCR exams, and also the last 3 years we are supposed to do the diploma in nuclear medicine. And it's the diploma in nuclear medicine is awarded by the King's College London, or is it the Brighton and Sussex College? One of the deanery will be one of the university will be awarding the diploma in nuclear medicine, and at the end it will be the CCT. Um, so just let me show you. So these are the generics and specialty specific SIPs. Yeah. So regarding the exams, so by the end of ST5, you're expected to complete the FRCR Part 1 and the final FRCR 2A. So at the end of ST5. And during the ST6 to ST8, you're supposed to do the final FRCR 2B and also the curriculum for the diploma in nuclear medicine training, that exam as well. Then just a quick go through regarding the procedures. Then why you when you asked why nuclear medicine, because of these interventions and the procedures or that are done under nuclear medicine.
Can I
So
interrupt you, Dr. Rafiq? Just wanted
yeah,
to know, as I could hear your kids' uh,
yeah. It's
voices. So just a bit of a family man question. How do you cope with all these exams, man? Because see, I'm a family man myself, and studying. I'm not blaming the kids, but it's difficult, isn't it? Because they've got their needs, they've got their requirements, and you as a father have to do your job as a father, and yes, of course, as a husband, and family man, earning and stuff. So how do you cope with it? And what's the plan like? Because I've heard FRCR are quite hard exams. So what's the plan?
so that's a good question as well as a difficult question to answer as well. So it's all about keeping a balance between our work or our career and the family. Sometimes it can be difficult, and at the same time, one good thing about what I think about radiology is that unless you start, you won't understand how can it be like the work challenges and academic challenges it's going to have. But one good thing, at least the deanery I'm going into, it's more academic oriented deanery. So I'll be going to the southwest. So at least for the first year, we'll be focusing more on the exams. So when you're in the academy, spending your time, you'll be getting a lot of protected teaching hours, and the lot of teaching happening, regular teachings, and more exam focused preparations are going on. Coming to the final FRCR again, once you start the on course and your job becomes a bit more responsible, then again, we should somehow try to find some time to prepare for the exams anyway. So
It's easier
unless
said that
you're
than, but that's what the other radiology
absolutely.
trainees have told me. Like, radiology is a specialty where you're actually given time and there is an effort to actually, make you prepare for the exams. Rather, as medics, we just go on bang, 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 bang work and that's it. You're back home. All right. Yeah. So you were telling something about the procedures.
Yeah, so just like a quick go through, because many people don't know what are the procedures that are done at a nuclear medicine. So basically, it's all these PET scan, SPECT scan, this single photon emission or the positron emission scans. So all these medical specialties like oncology, so cardiovascular, there can be cardiovascular MRI or the cardiovascular PET scan, the SPECT scans. These are all done. Myocardial ischemic stress test. So the MUGA test. There are a lot of viability tests as well. So coming to musculoskeletal, there are musculoskeletal nuclear medicine, pulmonary nuclear medicine, renal, neurology, endocrine. So that's what I was saying. So it's not like you're branching off from medicine. It's like it's a branch of medicine basically. So we need to, if you have a good knowledge about the general medicine stuffs, then it will be much more useful for interpreting the images, and also to have fruitful MBT discussions and things like that. And on top of that, one important thing when you are proceeding through this particular pathway is the nuclear medicine therapies. So if you start as an ST1, if you go through the ST1 clinical radiology thing, you at the end of third year you will be doing your exams, and then by the ST4 and ST5 you can do 2 years in specialty interest. It can be musculoskeletal, it can be whatever, like a neuroradiology and things like that. But if you're doing nuclear medicine, you'll be finishing in 5 years, but you won't have this opportunity to administer therapies. So nuclear medicine therapies can be administered only those who are doing through this pathway, starting as an ST3. Okay, so the other radiologists will be radiologists with nuclear medicine interest. They will not be known as nuclear medicine physicians. But if at the end of 5 years, if they do 1 year of dedicated training in nuclear medicine, I heard they are also get this nuclear medicine therapy opportunity. But this require what is called I think it's ARSAC, Administration of Radioactive Substances for Treatment, the RSAC license. That's the license we get at the end of this training. So this just also says the indicative numbers of procedures or reporting you should do at the end of the training. So it's in huge numbers. So again, it's a quite an academically challenging specialty. See if you see the PET scans and all these images are going in 800, 700, 500 reportings. You should administer all these therapies and these things. So it's definitely, I've spoken with a couple of trainees. They said it's a very academically challenging specialty, but at the same time, it's a very rewarding specialty with a lot of clinic. I mean, it's a lot of involvement, and it's a true multidisciplinary
Okay.
specialty as well. Yeah.
So, Dr. Rafiq, to sum it all up, what's your take-home message for guys and girls? Because I think it's high time now. If you want to apply for
Yeah.
specialty, you should be ready. So, what's your take-home message for guys and girls who want to apply nuclear medicine?
So my take-home message will be not to be very focused with the group one specialty. First of all, there are a lot of opportunities and a lot of interesting things that is happening in group two. Although the number of training posts available for each of them are quite less compared to the group one. Those who are looking for a good work-life balance and those who want to have a bit more relaxing career than the group one specialty, I would suggest group two. At the same time, utilize your time and work smartly. Just spend your time, limited time for the portfolio things which scores maximum for your given time. Do the train testers week. Just if you're looking for a slight deviation from your general medicine thing, like a career changing type of thing, although the route is back to medicine, if you want to have a deviation, then maybe after at the end of IMT3 or uh, what to say, after doing a lot of registrar jobs, maybe many people will be quite exhausted or want to have a change or a specialty. Then they should consider specialties like this. Get to know more about it. Try to speak with the trainees. Spend time with the trainees. They'll give you useful tips regarding how to apply, how to get into the training, and further things.
Great, great.
Yeah,
Thank you so much, Dr. Rafiq. That was quite insightful for people who would be applying, right? Just not from the eligibility, but you've given them a good insight of the training itself, including the exams and the things that they should embrace themselves for the storms coming short. But yeah, you'll be great. So all the very best. Thank you so much. And guys and girls,
thank
if
you
you
so much.
got interest in nuclear medicine, as Dr. Rafiq has said, you can just follow the video. And yeah, all the very best to all of you guys. Do like and share, guys. Cheers. Thank you. Thank you so much. Take care, Dr.
Thank
Rafiq.
you so much.
Bye.
Thank you. Thank you. Bye, Aman.